everyone, good morning. It's Monday and I'm just in the car driving to my first class of the day, and I did want to film this video at the weekend but kind of didn't really get time to do it, so I thought, oh, I'll do it in the car. The last video I did like this, I did it just driving in the car, and I wanted to do a little update on my HRT because I thought, oh, I haven't done an update on that recently. Then when I went and looked back at my video, it has been a year. I've been on HRT for a whole year. So yeah, I thought I would just kind of do a little update if it's something that, you know, you are thinking about going on to, or, you know, yeah, I just basically thought I would just share anyway what's happened with me. So I will link my other video below letting you know like kind of why I went on HRT, but basically I was having lots of perimenopausal symptoms. I was not having periods for like months and months at a time. I think the longest I went was like 8 or 9 months without a period, and this was happening quite frequently, and I was getting night sweats, like pretty much every night getting night sweats, which was just awful. I was getting like a nasal drip, brain fog, like all the things, and really basically just not really feeling myself, which is, yeah, one of the main reasons. And I did leave it, and then like I'd spoken to the doctor a few times, and then she was like, look, I think you should just give HRT a try and see how you get on with it. You know, you can always come off it. So yeah, the first few months everything was really good. In fact, the whole time it's all been pretty good. But then at the beginning of this year, so I want to say around February time, I started to get quite frequent night sweats. Now the night sweats had kind of stopped at the beginning, and then I started to get the odd one or two, which is fine. I don't mind getting the odd one or two, but then they started to come back quite frequently. I was having them like 2-3 nights on the trot, and yeah, I was also getting a little bit of joint pain as well, which if you have seen any of my other videos, I have rheumatoid arthritis, and you know, the joint pain could be related to that, it could be related to the menopause, but ultimately I hadn't been having joint pain and suddenly I was having it. And also I've been feeling like really tired, so I was starting to think to myself, well, maybe the patches are just not working, and then I kept thinking to myself, oh no, maybe it's just because it's winter and I'm just, you know, maybe not eating right, maybe. So anyway, I kind of went another month or so, and then it got to March, and every 3 months you have to, that's when you get your kind of repeat of patches, and I have to go to the surgery and just do my blood pressure, and then they reissue me with another 3 months. And so I had 3 patches left. Now you take like 4 patches. Is it 4 patches? No, we take 2 patches. 2 patches a week. And what was I saying? Yeah, we take 2 patches a week, and I had 3 patches left. So essentially that was like kind of a week and a half. And I thought to myself, do you know what? I'm just not gonna take the patches, and I'm just gonna see what happens. So that's literally what I did. I didn't renew the patch. I took a patch off, I left it, and I left it for a good couple of weeks. And I honestly, towards the end of those like couple of weeks, I just started to feel awful, not myself again, feeling like really rough, really fatigued. I was definitely getting more joint pain than I had been getting, and that was something that was quite significant. So obviously because of my arthritis, I was not really sure if it was to do, if that was kind of the perimenopause was making it like worse or anything. So yeah, it's been a good couple of weeks, just didn't feel myself, and I thought, you know what, I'm just going to go back on the patches. I put them back on, and within a week I felt so much better again. So they are doing what they're supposed to do. I don't know whether you can change the dosage or anything, but since I've been back on them, I have felt so much better. I haven't really had any night sweats, so I don't know what it was that caused those night sweats. Maybe it was just like a surge, or I was gonna say a surge of hormones, but maybe it was a dip in hormones. Who knows what it was. But anyway, yeah, so just wanting to just kind of let you know, other than that, I get on really well with the patches. So just you know, I think it's just a little bit of, just for my own kind of mindset. You know what it's like when I think sometimes your body gets used to like medication and stuff, or whatever it is that you take, and then you think it's not working, but they are definitely working. They are definitely doing a job for me, and yeah, so I'm going to continue. There is a few things that I want to explore, like taking collagen and that. I need to kind of look at that, some little boosters. I think maybe I need a little vitamin boost of some sort, to just help me. I know magnesium can help you with sleep, and B12 I think can also help you with that kind of fatigue feeling. Again, fatigue is another symptom of rheumatoid arthritis. So, you know, I've got like this kind of, is it this, is it that, I'm not sure, but it doesn't really matter. Trying to deal with it is what matters. You're just trying to deal with it in a way that suits your body and the way that suits you. So that's something that I'm definitely going to look at. One thing I will say about the patches is they leave that horrible kind of sticky mark on your leg. So when I'm wearing like yoga pants, if I put a patch on, so say I put a patch on today and I wear yoga pants, it's fine. But as soon as like I put on a pair of jeans or, you know, some trousers or something, it gets like this horrible kind of dirty sticky mark, and you can't really do anything about it until you take the patch off, because if you try and add some lotion or moisturizer or something to your leg, the patch just comes off. But what I have found is that when I take the patch off, the best thing to, so you don't kind of, you're not rubbing and scrubbing your skin so it's red raw, the best thing to put on it is Vaseline. Rub some Vaseline on the stickiness, leave it for like a minute or so, you don't need to leave it for long, and then just really gently do like little circular motions with your finger over the stickiness, and it just comes off really easy. Don't need to scrub hard, you don't leave like a red mark or anything. So that's my little tip. My little tip, if you use patches, that's really worked for me. Obviously if you've got any other way of getting it off, then that's fine. I haven't gone swimming or anything since I've had HRT patches, which apparently you can go swimming, but oh my god, if you have that dirty sticky mark around your patch, you literally wouldn't want to go swimming with that. So I can't like shed any light on the whole swimming thing, but it's really good, it never comes off in the shower. So yeah. One thing as well, that if you get out of the shower and you moisturize your body, don't moisturize where you would put the patch, because again that can kind of lift it and stop it sticking. So I always kind of leave that, just that little patch of my leg without any stuff. So yeah, that was my little update on HRT. Not really much to tell you other than, you know, I thought maybe it wasn't working, and yeah, it definitely is doing me some good and making me feel better. And I do feel like I need to kind of look into, you know, what can make me feel a little bit better in terms of fatigue. Yes, arthritis, fatigue's a symptom of that. It's a symptom of perimenopause. I teach yoga, so I'm going to get tired as well. But tiredness and fatigue are kind of two different things. It's very different fatigue to, you know, feeling sleepy, tired and wanting to go to bed. So if anybody's got any advice, anything that you can take, any supplement or anything that, you know, can kind of help with that fatigue feeling, then yeah, I would love to know. Okay, so that's my little update on HRT. If you want me to do any other like update or anything on this sort of thing, let me know. I'm hoping to do a few more little videos because there's some things that I've kind of learned to do as well, and incorporating yoga and stuff as well has been really, really helpful for me. So hopefully I'll do a little video like that soon as well. But other than that, thank you so much for watching. Give me a little like, subscribe if you're not subscribed already, check out my yoga videos. I've got yin yoga, chair yoga, some joint friendly flows. The joint friendly flows are really good as well if you do have those kind of joint aches and stuff with perimenopause. You know, just want something a little bit easier than doing like these kind of full yoga practices where you like down on your hands and knees and stuff. So yeah, check them out. I'll leave a little link down, a little playlist down below of my little joint friendly flows as well. But yeah, hope you have a good day. Thanks for watching. Bye.